Hi, my name is Macy Beener, and I would like to discuss the disorder of cerebral palsy. The key topics that I would like to educate you about are first, what is cerebral palsy? What are the risk factors? What does a child with CP look like? The different types of cerebral palsy, education for patients and families, who is involved in the child's care, what complications can happen, and how do we treat CP? First thing we need to discuss is what is cerebral palsy. Cerebral palsy is a brain disease that causes paralysis. Cerebral palsy is a neuromuscular disorder that causes the child to have loss of muscle control. These affect not only the child's muscle control, but their coordination and their posture. It can cause abnormal perception and sensation, visual, hearing, speech impairments, seizures, and cognitive disabilities. All patients with CP have problems with movement and posture. Many also have related conditions such as intellectual disabilities, seizures, vision, hearing, speech, changes in their spine such as scoliosis, or joint problems such as contractures. There are 3 different types of cerebral palsy. These affect the different areas of the brain. The most common is spastic CP. With spastic CP, the things that you are going to observe in the child or infant are tight, stiff muscles, jerky movements, hypertonic, which is the muscles continuously are flexed. The Babinski reflex will be there. They will exhibit toe walking because their calves are always flexed. The second type of CP is dyskinetic. They will have involuntary movements, dystonia, which is random, slow, uncontrollable movements, and chorea, which is random dance-like movements. The third type of CP is ataxia. They will have uncoordinated, shaky movements and poor balance. Cerebral palsy is the most common motor disability of childhood. About 1 in 323 children have been identified with cerebral palsy according to the estimates from the CDC. The risk factors for cerebral palsy can include both prenatal and postnatal causes. For prenatal causes, they could include infection, hypoxia, radiation, and placental issues where the baby or fetus in utero is not getting enough oxygen via the placenta. Postnatal risk factors include head trauma, infection, and hypoxia. Cerebral palsy can be caused by a genetic mutation also. This disorder does not get worse over time as it is a non-progressive disease. Several other risk factors include premature birth, multiple births, or very low birth weight in newborns. The physical assessment findings for the children with CP mainly are failure to meet the developmental milestones. They're going to have rigid posture in extremities and abnormal posturing. So a lot of the times they'll be crossing their legs. A lot of times parents will say that if the child is less than 6 months old, some things that they observe in their child are that their head lags when they go to lift the child up from their arms. Their head will lag, lack of that muscle tone in their neck and back of their neck and the front of their neck. They will be stiff, floppy, and have crossed legs or scissoring of the legs. When they're over 6 months of age, the baby may not roll over left and right. They cannot bring their hands to their mouth, or they cannot bring their hands together. Over 10 months of age, parents notice that their babies are crawling lopsided. So they're scooting more on their buttocks rather than crawling on all fours. For diagnostics, parents often report some of the abnormal symptoms shown when the infant or child is not meeting their developmental milestones. So, we're going to do a complete neurologic assessment, metabolic and genetic testing. We're going to observe their general movement assessments in children older than 2 years and younger than 5, and they may order an MRI study. For nursing care, children will have pain due to the tightened muscles and stiff joints. They could have trouble eating, so assistive devices may be needed for these children. Sleep disorders can also occur due to the patient being uncomfortable and having pain. They could have trouble speaking and intellectual delays. We 100% want to provide skin care to these patients, whether it's an infant, a young child, or an adult. These children are usually wheelchair bound for a lot of the time. So if the patient's CP is progressing to a point where they need to be in a wheelchair, that skincare is going to be very, very important to prevent any further complications. This disorder is not curable, but it can be managed with treatment of symptoms. We 100% also want to promote independence. Think about how terrible it would probably feel to be a 16-year-old girl. You cannot communicate verbally. You're in a wheelchair. You are not able to feed yourself. So we definitely want to promote as much independence for all of these children as possible. And that's involving the parents and families as well. We want to do individualized care because not all patients with CP are going to be treated the same. They may be at a different progressive state. We want to monitor their developmental milestones and always maintain an open airway. We also are going to be administering medications for pain and or spasm as prescribed by the provider. Medications that could be prescribed for these patients are going to be muscle relaxants and anti-anxiolytics for seizures. We want to relax the muscles, therefore hopefully to decrease the pain for these patients. They may use orthotic braces to help with physical therapy portion of their treatment. Surgery may be required, but they do like to do that as a last resort. Surgical intervention may be needed to loosen tight muscles or straighten bones due to contractures. One of the medications that is most prevalent for cerebral palsy is baclofen, which is a muscle relaxant. And if you look here in this little picture, I do have a picture of a child here. This is actually a catheter that's inserted into the spinal column, and it's a pump that goes right underneath of the skin, which delivers the baclofen. The care team for these children is a multidisciplinary approach. So there's not just going to be one person involved. It's not just going to be their physician or physical therapy. They are going to be needing to see a neurologist, rehab specialist, occupational therapy, physical therapy, speech therapy. The disorder is not curable, but we do want to improve the child's quality of life. So in order to do that, we have to have all of these care team members on board, working together with the patient and their families. Physical therapy is most certainly going to help build the strength in these children. We want to improve their walking as much as we can, even with using assisted devices if needed. We want to do some stretching to kind of decrease the muscle and joint pain that they could be experiencing. Surgical intervention if need be, hopefully last resort. And then they also will probably be seeing a nutritionist. We do want to encourage them to eat foods high in fiber to prevent any constipation. We do want to provide family-centered care. The family is the constant in the child's life, and that they are the expert on the child's ability and their needs. We want to ask the family about their routine care of these patients. We want to help the child use augmented communication devices. We want to include the family in physical care, and we want to encourage the family to help identify the child's needs if communication is impaired. We can also offer group therapy or support therapy for these parents. It's obviously very, very stressful, and I'm sure it could be very overwhelming to take care of any child, let alone when you have a child with cerebral palsy. You're going to need some extra support. Here's a photo of a communication board that may be used for patients with CP who are unable to communicate. Complications of cerebral palsy include aspiration and potential for injury. These are the two big ones that I think are most important when it comes to cerebral palsy. If you think about it, they are at big risk for aspiration. They have weak muscles. So these muscles are also going to include those muscles of the pharynx, the larynx, and their oral regions. So we want to make sure that we're monitoring for any aspiration. This could be if they're eating, drinking, head of the bed's not elevated. They have those weak muscles, and we know that, so that's something we need to be proactive about. Potential for injury, if we think about that as well, uncoordinated movements, weak muscle movements, jerking, so they're going to have that poor balance. So we also want to make sure that we have their bed rails up, we have padded sides on their beds and their wheelchairs, and we also want to provide adequate rest for these patients, children, adults, infants. We do want to do that because if they're already having poor balance and weakened muscles, we don't want them to be over fatigued and have injury due to being fatigued. So we definitely want to provide them with adequate rest. For education, we want to consider participation in support groups for cerebral palsy for their parents and or family members, caregivers. We want to provide developmental stimulation for these children, and we want to adhere to the medication regimen. We always want to reevaluate and keep that care plan ongoing to consider resources that may be needed for these patients. We want to provide adequate periods of rest. We don't want to overstimulate, and we don't want to exhaust them to cause them to have any type of injury. Hope you enjoyed this video and have a little bit more knowledge about cerebral palsy. Thank you.